Good day, everyone. I will be talking about medical technologies job opportunities. Medical technologies is one of the in-demand jobs in the world. In line with this, I want to give you a list of job opportunities when you pass the licensure exam. If you want to interact with patients, some of the career paths to consider are phlebotomists, surgical technicians, MRI technologists, and radiologic technologists. But if you want to work completely in a laboratory, you can be cytotechnologists, dental lab technicians, clinical lab technologists, and laboratory support technologists. Furthermore, you can be also a professor at a university, a researcher, an entrepreneur that sells medical equipment, and work in an office like Department of Health. So, have you chosen a job?
Have you ever wondered what happens when you get your blood works done in the hospital? In the hematology section of the laboratory is where these blood works go after extraction. Several tests are performed here and commonly use components of whole blood as their specimen. These tests include the complete blood count, which is a basic screening test that will give a valuable diagnostic information regarding the hematologic system and many other organ systems. Another would be a procedure which measures the number of platelets which aid the blood in healing wounds and prevent excessive bleeding called the platelet blood count. Extensive increase and decrease of platelet levels can be a sign of a severe condition. Lastly, the reticulocyte count test which measures the levels of reticulocytes in the blood. The said test indicates if the bone marrow is producing enough red blood cells, which is essential in moving oxygen from the lungs to every cell in the body. But besides the tests mentioned, there are more tests that use blood as their specimen.
To carry out the total safety of laboratory workers, there is what we call biorisk management. It is the effective management of the risks present in laboratories when working with infectious agents and toxins. It is divided into three primary components: assessment, mitigation, and performance. The AMP model is based on a three-legged stool. This means that all components should be given equal attention because the biorisk management system fails if one is overlooked or not addressed properly. The robust risk assessment is the heart of the biorisk management as it ensures the safety and security of laboratory workers by identifying the hazards and risks that are possibly present. The mitigation procedures are actions and control measures that are put into place to reduce or eliminate the biorisks. There are five major areas of control measures, and the hierarchy goes from the most difficult to implement yet is the most effective to the easiest to implement but is the least effective control measure. These are elimination, substitution, engineering controls, administrative controls, and personal protective equipment or PPE. The last component is the performance evaluation. Note that it is not a linear process, but rather a continuous process to monitor the implementation of the procedures and practices. With this model, one can ensure if the implemented mitigation measures are effective or ineffective in reducing or eliminating the risks.
In 1869, a French researcher named Frederick Micher was just trying to understand and study the composition of lymphoid cells, or also known as the white blood cells. But when he was busy doing that, he accidentally isolated a new molecule and called it as the nuclein. That is how DNA was first discovered. But his discovery was just the beginning of everything. The American biologist James Watson and the English physicist Francis Crick furthered his discovery and gave DNA its distinct characteristics, functions, composition, and mechanisms. The discovery of DNA is just one of the many significant things that biochemistry gave to the scientific world. If you're wondering, biochemistry is a branch of science that applies chemistry to the biological life processes of every living organisms. To give you a preview, some of the important concepts in biochemistry are evolution, matter, energy transformation, biological information, and macromolecular structure and functions. This subject is also one of the most important things to study when it comes to the medical field. But it is not only about understanding and studying the biological life processes of every living organisms in this world. It is also meant for people to appreciate life more. Now, I can tell you hundreds of different things about the contribution of biochemistry to the scientific world and to the entire human existence, but what thrills me more is that these advancements and discoveries will never stop, because that is how amazing biochemistry and science is. They make impossible things happen.
Anatomy is the study of the structures associated within the human body. Physiology is the study of the functions of each of these structures. The human body is often thought of as a complicated machine. In order for the machine to work, it must have all of its parts. But, in addition, each of these parts must function optimally. If organs or organ systems are not functioning properly, then the patient is described as having a disease. Having an understanding of anatomy, physiology, and human biochemistry is basically like having an owner's manual for your own health and wellness. Having at least a rudimentary knowledge of these fields helps a great deal in knowing how to avoid injuries, how to treat illnesses, and when professional help is necessary. Having a good understanding of what's actually wrong makes your doctor's visits more efficient and saves you unnecessary trips to the clinic or the hospital.
The BS Medical Laboratory Science or Medical Technology is one of the best pre-med courses taken by students interested in taking up medicine. However, not all graduates continue to further studies of medicine. Others practice their original field where they work as medical laboratory scientists or medical technologists in a clinical laboratory. Others engage in research, and others become members of the academy. There are other fields that a medical laboratory science graduate may practice. Some are the fields of molecular biology, public health and epidemiology, veterinary sciences, food and industrial microbiology, forensic science, nuclear medicine, healthcare facility administration and management, and quality management. Medical laboratory scientists are not always confined to the four corners of their laboratories because medical technology is a multidisciplinary field that ventures other areas of healthcare and sciences.
Hello, I am Adam Trinidad, and I'm here to discuss what medical laboratory science is. BS Medical Technology, or Medical Laboratory Science, is a 4-year degree program that provides students with the necessary skills and training in conducting laboratory tests. These tests are used in detecting, diagnosing, preventing, and treating various diseases. A fun fact about this is that they work hand in hand with a pathologist in diagnosing various diseases. Medical laboratory scientists perform lab investigations based on specimens from the human body, such as urine, blood, and other bodily fluids, through the use of medical equipment such as analyzers, microscopes, and other precision instruments. To be a said professional, you must first pass the medical technologist licensure exam provided by the PRC, scheduled twice a year during March and September. The subject included under this program include biology-related subjects such as human anatomy and physiology, biochemistry, principles of medlab science, and more. Along with this are professional subjects which are composed of hematology, clinical chemistry, cytogenetics, histology, and more. Though a career in medical laboratory science can be quite a challenge, but also fulfilling. So, let me ask you this. Do you have what it takes to be a future medical laboratory scientist, or in the future, a future doctor? Once again, I am Adam Trinidad from VFU NRMF, a second year MedLab Science student.